So more significant, I want to draw your attention for this from my nephrologist friends. Around 50%, half of the patients having dialysis in the public sector patient, they are result from diabetes. Now think, if one patient, if you are the one with one relative at home, every time or every now and then, every week, maybe 2 or 3 times need to go to the hospital for dialysis. If you're using the public sector resources, you don't know the exact cost. But if you're in a private sector, you know every time you have to pay, you know how expensive that is. Some people, not a few, but many people tell me if one relative in their family need to regular dialysis, they almost burn out of their all savings. So this is very significant expenses in their family. And of course, this causes a lot of other comorbidity, ischemic heart disease, stroke, and also cancer. Now, before I proceed, because I know I stepped into another field of these topics like health economics, I want to introduce a little bit a few terms for you. When we talk about cost effectiveness of a treatment option, that means we are asking how much the money we are willing to pay for improvement in health outcomes. And what is health outcomes? It can be either counted as gain in life years, reduction in disability, or improvement in quality of life. All this has a parameter for measurement. And this could put a term called cost utility. It is measured as put into parameter, in clinical parameter and humanistic parameter as qualitative adjusted life years. This is a unit, like how to measure the health outcome. This is a unit, okay? Now, conceptually, when you offer what kind of treatment, if it is cheap, like if the medications or one kind of surgical procedure is cheap, but then it can bring out a significant improved amount. If you are the investor, yes, I would very like to buy it, right? I would like to invest. But if the surgical procedure is very expensive, like a very complicated procedure like liver transplant or esophageectomy lasts for a whole procedure lasts for a whole day, and in Hong Kong, which the cost itself may be 2 million. But then if that surgical procedure end up in a lot of complication and the patient you cannot cure 20%, cure the disease and that you won't much like to invest, right? So from the purely economic point of view, but if the surgical procedure is expensive to a certain extent, but can at the same time bring a significant improvement in the health outcome, then you may think, not every people is subject to this kind of treatment, but we need to set up a threshold or select certain high-risk patient or appropriate patient selection to offer these expensive treatment options and to bring out the benefits. Now, think, if you are the patients, even if the treatment option is very expensive, I would like to buy it because it doesn't matter. Money actually cannot buy health, right? If I ask you, if I pay like 200,000 to buy a renal function back, if I were I was supposed to have diabetes and my renal function is deteriorating next month or next year, I'm supposed to have dialysis. If I pay like 200,000 for you to get my renal function back, I would like to buy, or even 2 million, because you cannot buy it. It's going to deteriorate over time, right? This is from patient perspective, not measurable my money. So this topic is out for that perspective. But if you were the hospital authority administrator or you are country's health administrator, resources are scarce. You need to allocate to appropriate sector or appropriate aspect. Suitable patients should receive appropriate treatment options. You want to allocate to appropriate patients, but not all, right? So this is a different thinking on different patients. And if you are the insurance company, you intend to reimburse. I don't want to reimburse a patient for in the future for renal dialysis or stroke or MI. But if I reimburse a patient for bariatric surgery, that can prevent him from happening these complications. How long I'm going to return investment? So this kind of economic investment, right? So the thinking will be different from patients, but this is reality. The world is happening on this, right?